Hi, this is Chris Scordo. I've been asked by a lot of patients to, why don't I put something up on YouTube so they can show their other people, what mitral valve prolapse is all about, and hopefully this can help some people. And as you know, on YouTube you're limited to 10 minutes, so I am just going to give you some excerpts of what this syndrome is all about and what you can do to help yourself. I will tell you, though, for those of you that have an interest in getting some detailed information about mitral valve prolapse syndrome, what it is, what's the latest research, what you can do to help yourselves, you may be interested in the third edition of Taking Control Living with Mitral Valve Prolapse Syndrome. There's also some other references. I've done a number of publications on this. I just put some selected references there if you have interest in further reading. And in the book, each chapter is heavily referenced, so you can get even more information. And I start this out by saying, or giving these sayings that people have told me for years. Gosh, I'm 25 years old. How can I be having a heart attack? Nobody's listening to me. I don't understand this. What's going on? I'm thinking I'm crazy. Well, you're not crazy. There's a lot of physiological reasons for the symptoms, and we'll hopefully get a chance to talk about some of that. I will tell you, though, when you look at other cardiac disorders, and this is under the global heading of valvular heart disease, that this really is a relatively benign clinical entity. I know you're frightened by your symptoms, and you certainly need a lot more information. And a lot of this information takes a lot of time, and usually you don't find that in busy practices. Now, very briefly, the mitral valve is located on the left side of the heart. There's two leaflets, the anterior and the posterior leaflet. And if you look at the heart valves, there's basically 4 valves, and they act like doors so that blood goes in one direction. And the mitral valve, when it opens, allows blood to come, that's coming back from the lungs into the left atrium, the top chamber, down to the major pumping chamber, the left ventricle. So when you look at a normal mitral valve, this would be something that you might see on an echocardiogram. Anything that is dark is fluid. Anything that's white is a structure. And you'll see you'll have the 2 leaflets of the mitral valve that are held by these string-like structures that are held to these cords of the papillary muscles, which are attached then to the wall of the ventricle to help keep the valve basically in line. In somebody that has mitral valve prolapse, the anatomic, for whatever the reason, these string-like structures are a little bit longer than others, and allows the valve to buckle back or prolapse back into the left atrium. And if you think of a parachute as it opens up and the wind is into that into the sail of the parachute, it's somewhat similar to that. Now, when you look at mitral valve prolapse syndrome, you have one or more symptoms, and we'll look at those in a minute, that are believed to result from a variety of neuroendocrine or autonomic dysfunction. And the symptoms, the physical findings, are really not directly related to the mitral valve dysfunction, but believed to be related to these other forms of autonomic dysfunction. These are common symptoms that are usually associated with the syndrome, and unfortunately we don't have a lot of time to talk about all of these symptoms. And here are some other symptoms that have been reported by individuals, and this has mainly come from the studies that we've done. This is one of the studies that was funded by NIH, by the Division of Nursing. This is over 800 people that have mitral valve prolapse syndrome. They were diagnosed by their physicians. Either they had a click or a murmur, they had echocardiographic evidence of this, and these were people throughout the United States and some into Canada, and these are the common symptoms that you see, that we saw with these individuals. And interestingly enough, we saw what makes symptoms worse, and a lot of you can identify with this. And these are some results of what makes symptoms better, which I'm sure a lot of you have figured out yourself. Now, these are from a number of the studies that have been done, some of the abnormalities that one can see. These are really detailed in the book to give you a better understanding of what this all means. Because if you understand this, then there's certainly some interventions that one can do to help decrease, for instance, these high levels of catecholamines that one often sees in this syndrome. Now, the diagnosis of mitral valve prolapse, and I will say that years ago this was overly diagnosed, and the incidence of mitral valve prolapse is a lot less than what that we noted a number of years ago. But basically, just by listening to you, if you have a mid to a late systolic click, with or without a murmur, that really makes the diagnosis of mitral valve prolapse. It can be then further documented with a echocardiogram. The other testing is really not used to diagnose mitral valve prolapse. It's just that if you have some extra beats or there's some other symptoms that you have, your healthcare provider may want to pursue other testing to rule out other different types of diseases or syndromes. Now, from working with these individuals for over 20 years and doing some research on this also, we've learned there's a lot of things you can do to help yourself. They're really not related to medications, at least not prescription medications. And very briefly, by getting rid of the caffeine, any caffeinated products, over-the-counter medications that have any of these adrenaline-like substances, really reading labels so you're not taking cold medications that have pseudoepinephrine or ephedrine in them, because we know that these items, these food substances, can make symptoms worse. These are just a few of the medications that are over-the-counter that can give you some problems. The book really details all the caffeine and these medications and amounts. And briefly, also increasing fluid intake. A lot of these people are very sensitive to volume depletion, and that's why when you're sick, when you're ill, when you're vomiting, you have a lot more symptoms. By increasing your fluid intake, not cutting back on salt unless you've been told to do so, can help the symptoms of lightheadedness, dizziness, a lot of times also the chest discomfort. Also, pursed-lip breathing, that's detailed in the book to help you understand how is it that you can really decrease that symptom of that sudden feeling of shortness of breath that one can get. And then another thing, a lot of people experience that they have a lot of extra beats or palpitations while they're sitting and resting. If they get up and walk around, their own heart rate overrides these extra beats, and they start to feel a little bit better. We just call that locomotion. One of the best things you can do is to get out there and to exercise. This is a laundry list of some of the effects of cardiovascular exercise, and we had great results with the studies that we have done on people that are highly symptomatic, taken off their medications, and put on a 3-month structured exercise program, and they had a substantial decrease in their symptoms. We use what's called the rating of perceived exertion, the Borg scale, because when you look at target heart rates, most individuals with this syndrome, particularly when they first start exercising, have very high heart rates. So if you go with a perception, or your exercise to perception is somewhat hard, that usually is pretty effective. The other thing, too, is that a lot of people are very frightened by their symptoms, so if you don't like the way you feel, change the way you think, and that comes from reassurance, understanding more about this syndrome, and possibly doing some cognitive therapy. MVP is definitely a family affair, and it can be devastating when you have a wife or a mother that is highly symptomatic, afraid to do something, and so it impacts everybody. This is very brief, but there's so many things that one can do to help themselves with this syndrome. The study what we're working on now is looking at the effects of magnesium on symptoms, and the pilot study is very promising, and we've had a substantial decrease in chest pain and also palpitations. And if you're interested in participating in any of the research and you do have documented mitral valve prolapse, please contact me either through the university or at the other email that you see up there. And if you'd like more information on how to get the book, which really details this syndrome, also offers you a lot of references and includes information from the studies that we have done on this syndrome, be happy to give you that information. And I wish you all good health.